Welcome to Indiana University. At IU, our motto is to meet students' academic needs while providing resources to make sure those needs are met. Recent studies have found that college students would like information about sexual health from their professors and healthcare providers. In an attempt to provide adequate health services, each incoming freshman is provided with a health advisor. Just like an academic advisor, a health advisor will be matched with each student through their period of their undergraduate studies at IU. Health 101 has been added as a mandatory general education course that all freshmen will be required to take. As part of the class requirement, each student must schedule and have an initial meeting with their health advisor. From that time frame forward, it is up to the student's discretion to meet with their health advisors as needed to discuss matters pertaining to basic and sexual health. This collaborative initiative of IU and its health center is in its third year, and so far, results and feedback from students have been positive. Lauren Thompson?
Hello.
Yes, come on in. How are you?
I'm fine. How are you?
Fine. I'm Monica Smith. I am a health practitioner here at IU. And, of course, I am your health advisor. Every freshman is mandated to have one.
Okay.
So, what brings you to IU?
Public health is my major, so.
Wonderful. So, when was your last physical?
Right before I came down for orientation.
Okay. So, you're okay with that?
Yeah.
And are you sexually active?
I'm not a virgin.
Oh, I'm so sorry. What I mean by sexually active is, have you engaged in sexual intercourse or sexual activity within the last 3 months?
No.
Okay. Now keep in mind, we are here as a resource to you. So if you are, whenever you are sexually active, if you need condoms, if you need to talk about birth control, talk about relationship issues, if you think that there might be something wrong in terms of sexual health, you're more than welcome to come in and talk to me anytime.
So kind of like a medical counselor.
Yes, exactly.
Okay.
That's why we're here.
Oh, okay. That's good to know. I didn't know that.
So do you have any questions at all for me?
No, not really that I can think of at the moment right now.
Okay.
But I am here for credit, so could you sign this paper so my professor knows that I came in today?
Absolutely.
Sweet.
And keep in mind, after this, you're more than welcome to come at your own discretion to talk to me about anything.
Okay, do you have like any pamphlets or anything you want to give me?
Absolutely. In fact, there's a pamphlet that I was just about to give you that I give to all incoming students. It has information about just personal health and also sexual health.
Okay.
Okay?
Thank you.
You're welcome.
All right, you have a nice day, okay?
You have a great day. Wonderful meeting
Thanks.
you. Come on in. Hey, Summer.
Hello.
Hey, how are you?
I'm good. How are you?
Good. So you're in your junior year now.
Yes.
That's exciting. One more year left.
Yes.
So what brings you in today to see me?
Well, unfortunately, my boyfriend just found out that he has chlamydia, and I was concerned about it because I felt like I was having some symptoms, and I just wanted to learn more about it and get myself tested.
Okay. So why don't we set an appointment for a vaginal exam,
Okay.
and at that point I can test you
Okay.
for chlamydia. Would you prefer that I test you for all STIs so I can do a STI panel?
Yeah, I think that'd be a good idea.
Okay. So let's see here. I want to get you in as soon as possible. How does Tuesday look?
Oh, that sounds good.
Okay. Do you prefer AM or PM?
Yeah, as soon as possible.
Okay.
Morning.
So let's set it for Tuesday, 10 a.m.
Okay.
Okay. All right, sounds good. In the meantime, I want to give you some information on sexually transmitted infections
Okay.
and some information on chlamydia.
Okay.
Now, you said your boyfriend was diagnosed with chlamydia. Is he on antibiotics?
Yes, he is.
Okay. Well, in the meantime, I'm going to give you some condoms so you use it while you're engaging in sexual activity, okay? Because
Okay.
I don't want you to give it back to him while he's on treatment, okay?
Yeah.
So in the meantime, use condoms until we get you tested and maybe get you on treatment, okay?
Okay.
Do you have any other questions for me?
No, I think that's all.
Okay, so I'll see you Tuesday then.
Yes, all right.
See you,
Thank
Summer.
You. Bye.
Come on in.
How you doing, Miss Smith?
Hey, Mike, how are you? I'm good.
Do you have any time to talk for a little bit?
Sure, I do. Take a seat. My 4 o'clock actually canceled, so this isn't a problem. So what brings you in today to see me?
I just came by to get some condoms.
Okay, but in the meantime, let me pull your file.
Okay.
Okay. So you're coming in today to get some condoms? Anything else other than that?
No, I've been engaged in anal sex, and I just came by to get some more condoms.
Okay, great. So here you are.
Thank you. These work for oral sex, right?
No, these are latex condoms, so those will work well for anal sex and vaginal sex. But I do have some flavored condoms that work well with oral sex. Would you like some?
Yes, ma'am.
Okay. You see, one of the biggest misconceptions is that there aren't any flavored condoms out there, so a lot of people will have unprotected oral sex. And actually, you can contract STIs orally. Did you know that?
No, not totally.
Okay, so here are some flavored condoms for you. And also, I'm going to give you some information on STIs and HIV/AIDS, okay? Would you be interested in maybe a STI panel? Just to check up and just make sure that you don't have any STIs, just to be sure.
Yeah, I can do that.
Because I believe when you first came, we didn't do that. I saw you last year, and we didn't do that.
I learned from my health advisor that even if you're in a monogamous relationship, it's important to get routinely tested.
A person can have an STI and show no symptoms.
And that everyone should take the right precautions and be safe at all times.